Good afternoon, everyone. I'm just going to wait one moment to allow a few more folks to join us, and then run through a few housekeeping items before we get started. Alrighty. Well, it looks like we have a good group of attendees with us this afternoon. Thank you, everyone, for being here for this month's Virginia Governor's Conference on Aging webinar series, which is generously sponsored by Virginia Housing. We will have, this is being held a week early due to the holidays, and the same will take place again in December. So I'll drop some more information about the upcoming webinar in December, which will be held earlier on December 12th. That will be on disrupting ageism through lifelong learning. I think with a focus on purpose, belonging, and mental stimulation. And I'll share the registration link to that in the chat in just a moment. Also in the chat, I will share the link to the VGCOA YouTube page where the recording of this webinar will be posted by the end of the week. You can also find all previously recorded webinars in the series there. We really do encourage questions. Please submit your questions through the Q&A box as opposed to the chat box. That will just help us keep track of all inquiries. We do have a full run of house today with many speakers, so hopefully we'll have enough time. But if not, I know all of our organizations and representatives with us are more than happy to be a resource after the webinar as well. So I will go ahead and hand it over to Martina James with the Virginia Association of Area Agencies on Aging.
Thank you, Jillian, and thank you to everybody who is with us today. I want to welcome you all to our 2026 Legislative Priorities webinar. We are really excited to be sharing with you and joined by a really great group of partner organizations today. What I do want to recognize is not only my partners who are joining us, Erica Wood from Northern Virginia Aging Network, Jared Calfee from AARP Virginia, Dana Parsons from LeadingAge Virginia, Josh Myers with the Alzheimer's Association, George Worthington with the Alzheimer's Disease and Related Disorders Commission, and Sarah Stowe from the Commonwealth Council on Aging. But I also want to recognize that we know that there are numerous other organizations and advocacy groups doing this advocacy work, expanded beyond our own organizations and throughout our networks across the Commonwealth. And so I would encourage you, if you are with one of our own organizations or you are with an organization that is part of our networks or expanding beyond our networks doing this advocacy work, you help make our voices louder and stronger, and that is important in the work we are doing to support older adults across Virginia. So take a minute and let us know what organization you are here with. We'd love to be able to include you in this collaborative work that we're doing across Virginia, because it's really important that we work together over the next several months to make our voices heard and to raise these priorities and issues to support older adults and caregivers across the Commonwealth. So thank you for being here. We're excited to spend the next hour with you. So with that, I am Martina James. I am the legislative liaison with the Virginia Association of Area Agencies on Aging. Again, as Jillian mentioned, this webinar will be recorded and we will be sharing that in case any of your colleagues missed it. But I do have two other teammates that work on our legislative team, Eldon James and former Senator Emmett Hanger. So those are the team that represent the 25 area agencies on aging across the state. We are comprised of the network of area agencies on aging that you will see on this map. If you're unsure of what area agency on aging may serve you, a loved one, a colleague, or a possible client, or someone that is in your district, you can go to VAAA.org and select Find My Area Agency on Aging, and you can select by locality. And there's a really great tool that will help you identify the area agency on aging that is servicing your area. So quickly before we move into the key legislative priority for the area agencies on aging, I want to do a quick snapshot on why this is so important and the issue that we're on the cusp of in Virginia. So Virginia's population is really on an uptick. Virginia's population by 2020 is set to see a 22% increase. That's 1.9 million people increase. But of that increase, 69% of that increase is 60 plus population. So Virginia's most at-risk and vulnerable population, those 85 and older, will quadruple in that time span. So we're going to go from 157,000 or 158,000 to 653,000. And that increase is incredibly significant. We're looking at, for the first time in history, having more people over the age of 60 than individuals 0 to 19. So the work that we're doing in this space is critical, and the priorities that our organization and our partners are doing is critical to the supports for our colleagues and our older adults in Virginia. So the area agencies on aging serve every locality in Virginia. Our goal is to keep older adults in their homes as long as possible. We know that that is the preference if possible. In order to do this, area agencies on aging depend on a combination of federal, state, local, and private dollars. And with the support of the state funding, this really is going to, in the long run, save the Commonwealth money. And as a side note, we are actually here at the House Finance retreat, and there was actually a comment made that when older adults are able to age in place, it does support that statement. So we're really excited to work with partners and hopefully move forward with this support. So what we are requesting in 2026 is the area agencies on aging is requesting a $10 million investment from the Commonwealth. We would request that $10 million is going to be distributed annually across the 25 area agencies on aging it'll be distributed by the interstate funding formula. That funding will support the unmet need for critical services to keep older adults in their home. We know that those services vary, that unmet need varies across the state. What is an unmet need in Southwest looks very different than Northern Virginia, looks different than Central Virginia and Tidewater. But those are services such as home care, personal care, transportation, home delivered and congregate meals, and case management. But that flexibility for funding is also critical to success for our AAAs. So what we're asking is that $10 million be a year after year investment by the state of Virginia. The $10 million comes from, over the past 15 years, the distribution of Virginia general funds has increased 26%. And while it's not incredibly significant, the population over 60 has increased 43%. But the buying power of that funding has decreased 47%. So what does that mean in dollars? What that means in dollars is over the past 15 years, that funding is $6.7 million. But to keep pace with population growth, there's a $2.7 million shortfall in funding. But to keep pace with inflation, there's a $7.3 million shortfall. So that $2.7 million shortfall in population growth and that $7.3 million shortfall in inflation gets us to that $10 million request. So that's where V4A our 25 area agencies on aging is really focusing our priorities this year to be able to support these 5 critical services that we see to be able to keep most older adults in their homes. And as I mentioned before, being able to keep older adults in their homes and any program that really elevates aging is a cost savings to the Commonwealth. So as we move forward, you will see that our partners in all of the priorities that they identify are all doing work in that space of elevating aging. And at this point, I will now hand it over to, as I mentioned, these are my colleagues, but I will hand it over to Erica with NVAN.
Great. Well, thank you so much. Greetings and good afternoon, everyone. First, I'd like to say kudos to the Virginia Association of Area Agencies on Aging for organizing this session because it really does set the stage for exactly the kind of collaborative advocacy that we need. The Northern Virginia Aging Network includes the Commissions on Aging, the area agencies on aging of Alexandria, Arlington, Fairfax, Loudoun, and Prince William, as well as a number of regional service and advocacy organizations. The Northern Virginia Aging Network has had legislative platforms since 1982. We generally have 3 legislative and 3 budget items. This year we have 4. So I'm going to run through each of those legislative items and each of those budget items. A little faster than I'd like, but I know we want to keep to our time frame here. So let's go to the next slide. And this next slide shows our 3 legislative items. The first has to do with affordable assisted living. We all know that the auxiliary grant, which helps to support low-income people in assisted living, is way too low to cover provider costs, that market rates are rising, and that the need is increasing. So one strategy, hopefully one among many, is to get some affordable units through the zoning process for new projects. That is, localities negotiating with developers for a certain number of affordable unit set-asides. So the code currently says that local jurisdictions can negotiate for affordable set-aside units for housing units, but not assisted living units. And we want to clarify that this applies to assisted living as well. So this is enabling legislation. It's permissive. It doesn't require or prohibit localities from doing anything. It's a small step, but an important step. Delegate Reeser sponsored this bill in 2024 and 2025, passed the House, passed the Senate, but was vetoed by the governor. We are hoping that it's going to sail through this year. The second item has to do with evictions, and this is in a very similar circumstance here. The Virginia eviction filings increased by over 700% from 2020 to 2025. And many older renters are cost burdens, and on top of that, homelessness of older adults is skyrocketing. NVAN supports increasing from 5 to 14 days. The eviction notice period, it was 14 days during the pandemic. Now it's back to 5. So last session, Senator Rouse and Delegate Price sponsored this bill, and we're hoping that that will happen again, and that it will pass the House and the Senate and go on to be approved by the governor. The third item is really not a bill. It's not a piece of legislation, but rather a request for a study. That study is of affordable housing options. It's a study of there have been a number of studies of nursing homes. I'm sure you've read some of these, assisted living, home and community-based resources, independent living, but no study has examined the whole range of housing plus care, housing plus care. And that is what we are hoping for, sort of a holistic study that looks at the affordability, accessibility, care quality, and potential for aging in place. of the whole spectrum, such that if you make a change in one part of the spectrum, as we're seeing, for example, with federal cuts, what ripple effects will that have on the other settings? Now, we have spoken to Delegate Hope, who has offered to check in with the Joint Commission on Healthcare. They have designated a study on assisted living, and we're hoping that this can be a part of or relate to that study. Additionally, the Joint Legislative Audit and Review Commission is considering also a study on assisted living and home and community-based care, and there may be some potential there as well. Those are the legislative items. Let's go on to the budget items. Okay, so the first item is asks for $2 million in funding for the long-term care ombudsman program for its critically underfunded local offices throughout the state. So we depend on our ombudsman program as an advocate and a voice for residents. They're the ones on the ground working with residents and resolving complaints. Ombudsman program costs and workload have increased, but stagnant funding for over 40 years, believe it or not, has left the local offices struggling. NVAN is delighted that Senator Surville has agreed to sponsor that long-term care budget amendment. The next budget amendment has to do with free statewide certified nursing assistant recruitment and training workforce pilot program. It's a mouthful, and it's a very exciting and important one. It would address the staggering long-term care staffing shortages and thereby boosting quality of care and compliance with standards. According to the Virginia Healthcare Association, currently 93% of facilities have CNA vacancies and 58% have no qualified applicant. So this pilot would support training and recruitment for 1,000 CNAs through the Virginia Community College system, which can use its existing infrastructure to do that. The idea is based on a similar program, which was very successful in Minnesota, recruited over 1,700 CNAs. This item has the support of AARP and LeadingAge Virginia, and Senator Favola and Delegate Willett will be sponsoring this item. The third budget item really has been covered by Martina and needs no introduction, would be singing to the choir. And we all know that Virginia's 25 area agencies on aging are on the front line in providing aging services, and that their funding has not kept pace with inflation or population growth. And so certainly NVAN is fully in support of the VNA request that Martina has outlined. And finally, the last item is Medicaid, which again is not a bill, it's more of a stance for action that we want to have our voice heard to oppose any cuts or barriers in access. The important thing to remember here, I think, to keep in mind, is that of the over 400,000 people under Medicaid expansion here in Virginia, nearly 50,000 are older adults. So administrative and work requirements that are for all of those 400,000 will be affecting those 50,000 older adults. And with that, and that's a lot to take in all at once, I know, I will turn it over to the next speaker.
Everybody, excited to be here and talk about AARP Virginia's legislative agenda for 2026. We have a pretty expansive agenda, so I'm going to try and get through everything as quickly as I can. Fortunately, we have some overlap with other groups here, including NVAN, so I'll not spend too much time on stuff that Erica has already talked about. Our agenda falls into four sort of big categories. The first is prescription drug affordability. The second is caregiving. The third is financial security, and the fourth is livable communities. So on that first category of prescription drug affordability, and I'll apologize also for the formatting here because this is going to be a printed booklet, and so it didn't transfer great to PowerPoint. I can try and clean that up before it gets sent around. But on prescription drug affordability, our top priority is creating a prescription drug affordability board that would have the power to set upper payment limits on certain high-cost medications. This is something that's been done in a few other states. The first state to set an upper payment limit was Colorado, which recently set one on Enbrel, which will save people, up to $30,000 a year on needed medication. We've gotten this through the legislature the last 2 years, but it has been vetoed by the governor. So we're hopeful that we can get this across the finish line this year, as it's supported by the vast majority of Virginians. We surveyed this earlier this year, and 84% of Virginians support this. Also, in the prescription drug space, we will be supportive of other things that may come along that will have a direct benefit to consumers on the affordability of medication. So we're going to be looking at things like bulk purchasing, or things that increase transparency throughout the drug supply chain, dealing with some of the middlemen like PBMs. And you'll see that some of the stuff in this agenda are specific bills that we are pushing, and some are more concepts that we're going to be looking for bills that we can support, or that we're currently working on developing bills around. You can go to the next slide. In supporting aging Virginians and their caregivers, the first priority here is instituting paid family and medical leave for Virginia workers. Virginia has about 1.5 million people currently serving as family caregivers. Those caregivers are the backbone of our long-term care system in many ways. And what we hear from people all the time is that they have to step away from jobs or reduce their hours to care for loved ones. And that is not a trade-off that we want people to have to make to provide this needed care. And so creating a state-run program that would provide paid time off for people if they need to care for a loved one is going to be a crucial lifeline for people that need it. And as you can see on there, 57% of Virginia's family caregivers are currently working. And I can speak from my own experience. My mom was a school teacher who had to step away to take care of her father when he had Parkinson's disease. And I know that's not a unique story, and something that we need to be able to deal with as a state. The next thing is establish presumptive. You can go back to the previous slide. Sorry, I got a few on here. The next one is establishing presumptive eligibility for home and community-based services. That's a mouthful, I know, but the basic idea is that when you apply for Medicaid for home and community-based services, there is a lag time between your application and your approval actually coming through on Medicaid and when you can access care. And what often happens is that people will go into a nursing home because they can get care immediately, even if they don't necessarily require nursing home level care. That's not what we want. We want people to be able to stay in their homes and communities as long as possible. And we want people who are able to stay in their homes and communities to do so. And so what this would do is give people the ability to get presumptive eligibility and access care in their homes almost immediately, so that they don't get forced into an institutional setting unnecessarily. This will also save the state money long term, because institutional care costs about 3 times as much as home care. The next one is ensuring that nursing homes are providing quality care to residents. Erica already talked about the CNA training amendment. This will be the 3rd year that we've brought that one forward, and we're really hopeful to get it across the finish line this year. We are also currently working with Governor Youngkin's nursing home accountability board that he has created. Our state director, Jim Dow, serves on that, and we're hopeful that some good recommendations are going to come out of the work groups that are currently meeting that we can support during the General Assembly session to improve things around transparency and ownership in some of the areas that we have concerns around. And then the last one is codifying the Uniform Healthcare Decisions Act. This is a bill from the Uniform Law Commission that would make some incremental but necessary improvements to our advanced care planning laws. And ideally, this is something that can be implemented nationwide so that there is consistency from state to state in terms of our advanced care planning laws. Now you can go to the next slide. In the area of financial security, our top priority here is regulating cryptocurrency kiosks, or crypto ATMs. For those who aren't familiar with these, they look like ATMs, but they're not ATMs, and you can find them in convenience stores and places around the state. And they have become a really big target of fraud. People will get a phone call and say you missed a grand jury summons. You need to go down and put cash in this machine, and then once you've done so, it's basically impossible to get it back. There was a story in Roanoke of a 71-year-old grandmother who lost $15,000 in a crypto fraud scheme, and these are currently totally unregulated. So we're looking at legislation that would, make you get these licensed with the state, put in place some daily and monthly transaction limits, put in place rules around ID and warnings about the potential for fraud and things like that, and just trying to put a regulatory structure in place to make sure that people are not getting taken advantage of, which, largely older Virginians right now, that is what is happening with these. We want to update the Virginia Human Rights Act to equalize age discrimination protections for older workers with other classes. Right now, there is a gap in the law where the age discrimination protections are different from other protected classes. We want to just even that out and correct that disparity in current law. And then finally, on financial security is SNAP benefits. I know this is a really difficult policy area right now with changes that have happened at the federal level and a lot of uncertainty over payments getting made at all. And right now, the state is trying to deal with, getting its error rate down so that we don't have a huge funding shortfall. But, all of that stuff aside, the minimum monthly benefit is just too low. $23 a month is not enough to feed yourself. And whether or not this is something we're able to get done this year, I don't know with all the challenges that SNAP is facing. But we're going to keep beating this drum for as long as we have to, because this is it's a huge problem among everyone in Virginia, but particularly a lot of older Virginians we hear from who are struggling to keep food on the table. And then the final slide is on livable communities and housing. Erica talked about extending the pay or quit period for renters from 5 to 14 days to just make it more likely that that period would intersect with a pay period so you can get caught up on your rent and not get evicted. She also talked about negotiating new affordable units for assisted living developments, which was a priority of ours that we'll be supporting as well. And then finally, just working to ensure that the affordable housing supply meets the demand. We've got a lack of housing in a lot of places, and that's something that we're going to have to address if we want to make housing more affordable for everybody. And then the last thing I'll say on all this is that this is not an exhaustive list of everything that we're going to be working on at AARP Virginia. We always engage on a number of issues, but these will be our top priorities for the 2026 session. And I think I managed to get through that in my time. So with that, I will pass it over to Dana from LeadingAge.
Good afternoon. Thank you all so much. I appreciate the opportunity to talk with you today about LeadingAge Virginia's legislative priorities for the next session. Next slide. So LeadingAge Virginia, we are an association that represents the full continuum of the not-for-profit older adult services and supports in Virginia. So just move on to the next slide to discuss a little bit about what we'll be advocating for in this upcoming session. Infrastructure and access. This transcends to all of our legislative priorities for the next session. I'll be talking a little bit about workforce, providers, and consumers, and related to infrastructure and access, this applies to all of them. So accessible, affordable housing, funding and solutions, reliable transportation, and comprehensive family and medical leave policies that support caregivers, aging services workforce, and those they serve. You'll notice that much of our priorities is in alignment with much that has been said today already. Next slide. So focusing in on workforce, some of our areas of focus will be living wages and eliminating the benefits cliff for all who work in the aging services field. And then to support investments to recruit, train, and retain a qualified, defendable, and diverse aging services workforce. Next slide. Our next area of focus is around providers, preserving the appropriate reimbursement. With so many threats coming from a federal level, there's a lot of uncertainty. So really focusing on preservation of reimbursement. Then focusing on sufficient resources and infrastructure to strengthen all aging services providers, and that's including Virginia area agencies on aging and organizations that serve the disability community. Then focusing in on balanced and informed policy and regulations that ensure quality care and services while fostering innovation and addressing older adult needs. And lastly, consumers. Equitable access to aging and disability services and supports, a robust, high-quality continuum of home and community-based services, and lastly, expanding food and nutrition assistance, including SNAP. We appreciate this opportunity, partnering with policymakers and providers, and Thank you so much. My contact information is on the next slide. So I'll hand it over to the next presenter.
Thanks, Dana. I'm Josh Myers with the Alzheimer's Association. I just want to thank the opportunity through Martina and the organization to have us all together today. Next slide. Uh, One thing we'll be pushing this coming session is renewing the sunset on the Alzheimer's Disease and Related Disorders Commission. This is the commission that's been on the books for a number of years now, and it has to be renewed every 3 years. This provides a good opportunity for the policymakers to look at what the function of the commission is. Are there any needs that need to be addressed? Are there membership appointments that should be addressed to be tweaked? As we are entering the world of treatment for Alzheimer's disease, that is something that we're going to be looking at doing, and it's great that we're going to extend this sunset another 3 years. Next slide. Dementia care specialists in the AAAs. Obviously, the 25 AAAs around the state. This would be a budget amendment to provide funding for a dementia care specialist in each of the 25 AAAs around the state. This would not utilize existing funds that currently go to the AAAs. This would be new money that we're requesting. There are several AAAs around the state that do some similar things around dementia care management. So this would look to build off that. Wisconsin is a state that we're going to try to model this off of. They're very successful with the program they've had in place. Theirs goes a little bit further. I believe theirs is one in each county in Wisconsin. Next slide. Funding for the Virginia Memory Care Project. This is an initiative at the Virginia Center on Aging at VCU. This is an item I believe we are the fourth state in the country to have codified a memory project program. This is a statewide registry. We put this on the books through Delegate Carr in 2024. And now we're going to come back around and ask for $300,000 for this to be funded. What that funding will go to is some staff and mainly a lot of the ID technology on the back end to make sure that what they collect is compliant with HIPAA, it's secure, and that's able to transfer easily into that data as they continue to grow. Next slide. Lastly, we have on here funding for first responder training. Several years ago, Virginia passed on the books first with law enforcement required training for dementia-specific training for all law enforcement across the state. This was also supported by the Sheriff's Association at the time. The next year, we came in and we expanded that same training requirement through the rest of the first responders, which include EMS, fire, and 911 dispatchers. What this would do is now provide for the design and delivery of that dementia-specific training. It would be housed through the Department of Aging and Rehabilitative Services. It would include an online platform to provide that training through No Wrong Door, and it would provide stipends for agencies, law enforcement agencies around the state to adopt and do this training within their new recruits and existing first responders. Next slide. Just a plug for our association's Advocacy Day, which will be Thursday, January 29th. 8 to 1 p.m. We'll be taking folks up on the Hill to meet with their legislators and advocate for all of our initiatives. And the email there, khgarner@alz.org, is our advocacy manager, if you'd like any more information on that. And I'll turn it over to, I think, George.
Great. Thank you so much, Josh. And thank you, Martina and crew, for hosting this wonderful webinar. Next slide, please. So I'm George Worthington, Dementia Services Director and staff to the Alzheimer's Disease and Related Disorders Commission. So I'm just going to cover some of the recommendations that Josh did not talk about. You can see the commission has 5 recommendations this year, and I'm going to talk about 4 of them a bit more, but the sunset, Josh has already covered, so I'll move on to the next slide, please. So the commission is proposing proposing state funding for the Virginia Lifespan Respite Voucher Program. If anybody is familiar with this program or has used it, it's a really wonderful way of providing caregivers much needed respite that they might not otherwise be able to afford. While it's not dementia specific, many of the folks that take advantage of this respite voucher program are looking after a loved one living with dementia. So this program offers a reimbursement for up to $595 per household per year. It's currently funded by a federal grant opportunity that unfortunately is going to see annual funding fall by half in the next funding round. And that would mean we would have to cut services to many hundreds of people. So the commission is asking for $500,000 in annual funding to support that program. Next slide, please. So the commission is also recommending a program of caregiver tax credits available for that would provide tax credit for expenses related to providing unpaid care for an adult or child. Again, this would not be a dementia-specific program, but would support people living with dementia and their caregivers. Caregiving for somebody with dementia is typically much more expensive than for other conditions. So this is something that could be a vital resource for folks living with dementia and their caregivers. We have models in a few other states. Typically, those are capped at a certain dollar amount of expenses per year that people can offset their taxes with. Next slide, please. So Josh talked a bit about the dementia care specialist, but I just wanted to reinforce that. This program, as Josh said, would put a dementia care specialist in each AAA. The General Assembly has been really great in appropriating funding for dementia care management programs. It currently funds 4 around the state, but those are serving about 400 families a year. And this would fill a gap for folks that might not need that much higher level of service, but would benefit from somebody providing connections to resources, services, education, training, and other supports. So the commission is proposing a $4.1 million appropriation to set up a statewide program providing 1 dementia care specialist in every AAA. I will say this program that began in Wisconsin has been replicated successfully by a number of other states, and it does seem like the future of providing dementia supports. Next slide, please. And Josh also talked about the training for first responders, so I'm not going to spend much time on this, but just to make sure that all existing first responders receive training. The mandate for first responders is going to be satisfied by training programs or new training programs through the academies, but it didn't make provision for existing first responders to be trained in dementia related behaviors and de-escalation strategies, communication techniques, and particularly important characteristics of different dementias. Again, the commission is asking for $2.5 million to ensure that a standardized training is available to all first responders. Next slide. So that's my contact details, and Heather Kidd, my staff, who's also staff to the commission. I'll pass it on to Sarah Stowe.
Thank you, George, and thank you to our organizers for this today. I am so glad to be with you all this afternoon and to share a little bit about the Commonwealth Council on Aging's 2026 legislative priorities. To give a little bit of background, the Commonwealth Council on Aging, or CCOA, as many know it, is a gubernatorial advisory board that's been established to provide a coordinated approach by state government to meet the needs of older adults. And amongst its duties is to advise the Governor and General Assembly on aging issues and aging policy. This year, the CCOA's legislative committee took a coordinated approach to aging-related legislation and thoughtfully chose 9 legislative recommendations. Throughout today's webinar, you all have heard most of them. So I won't spend too much time on the details of them. This strategic approach really allows CCOA to use its platform to help further elevate aging-related legislation. So next slide, I will share those with you. So our 9 legislative priorities are: the first is to increase funding for home and community-based services through area agencies on aging. The second is to increase funding for the nursing home inspection and enforcement process. The third is to establish a prescription drug affordability review board. The fourth is to strengthen nursing home transparency, data, and oversight. The fifth is to increase funding of the statewide long-term care ombudsman program. Number 6, increase funding for public guardianship program slots. Number 7, provide state general funds for the ongoing operation of the Virginia Memory Project. Number 8 is to extend the sunset for the Alzheimer's Disease and Related Disorders Commission. And lastly is to increase funding for No Wrong Doors statewide resource database. So we are very excited to be able to come together on this. And I think this webinar is another great example of how we have been able to kind of come together and really work collaboratively, and look forward to seeing what 2026 has in store for us. So I'll turn it back over to Martina and staff.
Thank you. Sorry, it took me a minute to get unmuted. Or still happens today. So as we heard everybody, and thank you everybody who participated. Thank you everybody for sharing who's listening, of all the organizations that you're a part of. It just shows how broad our networks are. There are some advocacy resources that can be used. This is not an exhaustive list, of course, but Virginia General Assembly website, Who's My Legislator? And I'll share a link in the chat in just a minute where you can actually access these links. And then when we share the PowerPoint as well, these will be live links, but the legislative meeting calendar will keep you updated about what are all the meetings happening every day throughout session and leading up to session. 2026 session calendars and deadlines. What are those? Pre-filing session, what are the pre-filing dates? When are your budget amendments due? What is crossover? Those important dates. Virginia Public Access Project is a great resource. They have a citizen's guide that tells you everything from where should you park, or what do you need to know when you go to the General Assembly building, or how to find a legislator's office, or what should you expect when you walk up and you are met by the secretary before you even get to a legislative aide. Such great resources. And we have a legislative tracking tool, and I share this only because, in full disclosure, I didn't get to have this chat with my colleagues before, and so I want to give them a chance. I will ask them what they have available, but this is linked here, and I'll be able to share what resources they say when I ask them this question. But V4A has a legislative tracking tool that is open to the public, and we share all of the bills that we are tracking as the area agencies on aging. So if we're tracking bills that have to do with veteran services or transportation or home delivered meals, whether it's a bill we support, whether it's a bill that we think maybe we are just interested in, or whether it's one that we might think might cause some concern, we have a website that will tell you in real time what is happening with it, what committee it's in, who's carrying it, and what the status of it is. So you can track that in real time, pulls from Lobbyist in a Box. So you'll have that link. And I don't know, I'd ask my colleagues, do you all have resources that are open to the public, or just your members that we could also share that are similar?
Hi, this is Dana Parsons with LeadingAge Virginia, and we have a resource for sending alerts to legislators. Those have become available on our website for specific issues during the General Assembly, and those links can be found. I'll put our website in the chat. Thank you, Martina.
Great. I will, what I'll do is, and Dana, I'll add that to the resource list when we send out the follow-up email. And then I think that'll be really helpful for everyone involved. Any other resources that other people have? I see Jared shared a link that's very helpful, where you all can get alerts for AARP. Anything else that you all see? And then I'll turn it over to Jillian to share any questions that have come in. And I've seen a lot of questions throughout, so I'll just go ahead and answer this. The PowerPoint and the recording will absolutely be shared. That's always shared post event. So we will get those resources out to you, along with our colleagues on here have been really great about sharing any of their advocacy materials or information materials. So we'll be providing all of that to you in a wonderful package after this is finishing up. So I will turn it over to Jillian to answer some questions, or to ask some questions for us to answer.
Thanks, Martina. A question that, or maybe more so a comment, had come in from Judy Hackler. Judy comments saying, another strategy to increase the number of ALFs accepting residents receiving the auxiliary grant would be to make the auxiliary grant a true supplement that does not subtract out of the resident's other income. The current calculation does not allow for the appropriated funds to the AG to be distributed. It reduces the paid AG rate by SSI, etc. So I'm not sure if any of our speakers have anything to add to that or to comment, but that was just a comment that had been submitted. And if not, we had just had a question come in about and I think Martina just touched on this a little bit, but will VGCOA send an update as to which measures were successfully passed during the legislative session? So again, that would the tracker and all the resources that are provided by our allied organizations here. I'm just checking the chat to see if we have any questions that were submitted there. Well, it does not look like we have any additional questions at this time. But again, I know that all of our speakers here are more than happy to be a resource offline if
I do know there were a couple. The registration.
Oh, yes. Thank you, Martina.
And in the meantime, I don't know if any of our presenters have any other thoughts or key advocacy pieces that they want to share. I mean, we do have some time, so.
So a question that was pre-submitted, what will advocacy look like relative to Medicaid reimbursement rates for personal care and respite care as it relates to addressing the workforce challenges in hiring and in retention?
Dana, do you maybe want to take that, or I think maybe you might be.
Sure. I would say that what advocacy looks like is making sure that you are monitoring the issues that come up that support that issue, and then contacting the legislators either through our grassroots system or sending messages directly.
Thank you.
Alrighty, let's see. What is the Aging Advocacy Collaborative doing to join forces with the Housing and Disability Advocacy Collaborative? Where do these agendas intersect? So I'm not sure if any of our speakers have any examples of where there might be some alignment or some pre-existing partnerships on that front, but I'll hand it over.
Well, I would just say that the NVAN priorities have a heavy emphasis on housing as well as healthcare and long-term care. And the study that we outlined would be, I guess, a start to that kind of communication because we're very aware that any changes in housing affect changes in healthcare, affect changing in all settings for aging. So I just wanted to put that on the table, but NVAN is strongly in support of, I think, obviously we don't want to work in silos and we certainly need and welcome more connections with the whole universe of advocates working on housing, of which there are many.
And I'll just add, even more broadly that we're always looking to work with partner organizations and build coalitions. As an organization that is nonpartisan and doesn't give money, we really have to look for other ways in a lot of the time. And so on any issue that we're working on, we try to figure out, all right, what other organizations will care about this? How can we work together? Sometimes we'll work with an organization that we might be on the opposite side of on another issue. But that's okay. We're always looking for what's the best way to get things done. And each of the groups here has their own list of priorities, and some of them are unique, but there's often overlap. And so, I've worked, I think, with everyone here at some point on some legislative priority, and will continue to in the future. And I know that's the case for everybody here.
And I'd like to add that Positive Age, which is a LeadingAge Virginia foundation, we have a Richmond collaborative nonprofits called Partnership for Positive Aging, United Voices to Support Older Adults, which came together to really convene a diverse group of not-for-profits to explore public policy and advocacy needs. I'll put the link in the chat for anybody who might be interested in learning more about that.
Great, thanks, Dana. We also have, and Dana, I think maybe this one is, I think any of us could answer this, but obviously being with LeadingAge, if some and these are all questions that were sent in with registrations, if some Medicaid services or programs are cut, what effect will it have on home health care or nursing homes? What are you all seeing from your partners in your LeadingAge space specifically?
Yeah, that's a great question. I would say that first I would respond that Medicaid is a huge uncertainty at the moment, and there's a lot of concern and fear. So when we're advocating at the General Assembly in previous sessions, we've all been about increases, but we're more about preservation for this upcoming session. And it makes me think, we think about nursing homes and home health, but also adult day. Their Medicaid rate is very low and about $65 a day. And so any cuts could be significant around that area. So in all honesty, it's really about preservation, what we're hearing and what we're advocating for at this time. And there's a lot of fear and uncertainty, and just trying to calm those with encouraging advocacy around preservation.
Thank you, Dana. And along the lines of uncertainty, we have a question that was just submitted. Whoops, sorry, it's jumping on me. How close are any of the organizations following the Affordable Care Act, and what would be the impact on if it expires with no plan in place pertaining to seniors affording medication?
Well, I will say that it's something that AARP is working on at the federal level. We have our state advocacy and our federal advocacy, and the push for the enhanced premium tax credits is a big federal priority for us because we know what a problem it's going to cause for so many people in Virginia and around the country if we don't continue those and we see healthcare costs start to rise. Unfortunately, that's something where our options for addressing that would be somewhat limited at the state level, just based on the money that we have. And so I'm hopeful that our folks at the federal level can get that figured out. To the point about medication, I talked about the Prescription Drug Affordability Board being our top legislative priority. But I also will tell people when we talk about that, that is not a silver bullet. And there is a lot of work that has to be done in that space to make prescription medication more affordable for people. And PDAB may help with certain medications and make things more affordable and bring some costs down. And we're confident in that. But it doesn't solve the whole problem. And it's something we're going to have to keep looking at and working on, because it's such a huge issue that we hear about every day from our members.
Thank you, Jared. Another question that we have, which may be best for Martina, is there any discussion within this community to establish more consistent funding for the AAAs? It seems like a huge percentage of funding is grant-based, which makes it really hard to plan for multiple years.
And I think that really speaks to what we're talking about with the $10 million investment from the state. And that $10 million investment is not one-time money. It's an ongoing budget allocation, because exactly what we were saying is over the past 15 years, the investment that we've seen is not keeping up with population growth and inflation. So that budget request directly addresses what you're saying. And so we have to see an investment from our local, state, and federal partners, but we're doing that we are right now addressing that by making a request in that $10 million budget amendment. So that's where we're starting right now with our 2026 priorities.
So along the same vein of, legislative tracking throughout session, a question that we received pertains to weekly meetings, potential meetings that, the public can join that are presented by any of these organizations. Are there any public-facing advocacy meetings that our attendees would benefit from joining during or after session?
I can comment on that. A session is so paced at such a high level that that's really challenging. I would just encourage folks to come to the General Assembly. We're always there, all of us, everyone I see here, to talk about issues and strategize. Not any particular meeting that I'm aware of, except that I would say that a lot of the General Assembly meetings have opportunity to testify virtually. So when those opportunities become available, I would encourage those attending to take advantage of that.
And I would say that, I second what Dana says. It's at such a fast pace that, setting aside a specific time, and it's just really hard. So we really do depend on those electronic updates that we mentioned at the very beginning. Our V4A's legislative tracker, because that's tracking in real time. We encourage you to use that. But Josh mentioned the Alzheimer's Awareness Day, Advocacy Day, excuse me, that they're doing. I know that the area agencies on aging have one planned. I think they haven't finalized those details. They have one coming up. I believe they're doing early February. I know there's a webinar coming up at the beginning of January that Commonwealth Council on Aging has planned, and I believe that's scheduled for January 9th at 1:00. We'll have more details. We'll include that information. So you have some resources coming up. Jared, if you guys have anything coming up, we can include that information in the follow-up. But we'll include all of these resources where you can track things in real time to keep you as updated as possible. So, and I know we're right at 2:00. So if anybody has any closing remarks, I will hand it off to you all. But again, all I can say is thank everybody for being here. Thank everybody for listening. And we appreciate our partners for taking the time to share such important legislative priorities as we look towards the 2026 session. Thank you guys, and we will see you in December.
Thanks.
Thank you.
Thank you.
Thanks.